This is your Filipino radio experience in Las Vegas. PHLV Radio.
The Filipino American Cancer Care now brings you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.
Good evening, ladies and gentlemen. Magandang gabi, Amerika. Magandang umaga, Pilipinas. Good morning, Philippines. My name is Josie Moralidad Azaiman. Welcome sa ating radio program On the Air with FACC, Filipino American Cancer Care, dito po sa PHLV Radio. Siyempre, it's Friday once again. At siyempre, kasama ko ang mga guwapings from Las Vegas. Sabi ko nga, what happens in Vegas stays in Vegas. We have the station manager of PHLV Radio, Johan. Is always behind the camera. And syempre, dito naman sa Virginia or Maryland, siya yung tagahawak ng pera ng bangko. Is one of our board of directors. He's very good in handling money. Ladies and gentlemen, please welcome Emerich Richie Vicente.
Hello, good evening everyone here in the US, and good morning Pilipinas. Welcome to our it's Friday again, right? To our new show and to our new episode, and we are really excited to talk to our special guest today. And how about you, Kuya Ed? How's it going?
Let me introduce him first.
Sorry, go ahead.
Okay. Now, I would like to introduce once again sa ating mga listeners, viewers, and followers, the most loving and napakabait na officer or director and co-founder ng Filipino American Cancer Care, Ed Logan. Hi, Ed.
Hey, thank you, Josie. Thank you, Emerich. I know this Friday again. I know it gives me pleasure to, give back to the community. And I'm so excited for our guests. Last time we had Dr. Cabebe. So I'm sure we have another top-notch guest for tonight. So can't wait.
Okay, and by the way, bago tayo pumunta sa kay Dr. Dizon, I would like to invite everyone this coming summer, June 19, 2021, we would like to invite everybody sa summer event ng Filipino American Cancer Care. Emerich, what are we going to have?
So we're going to have a mini concert and a Zumba contest. So we're really excited, and I think we have some beauty queens that's going to be our special guest and hosting the event.
Yes.
And of course, the 4 cancer beneficiaries that we're planning to help out. That's the reason why we have an event. Is for them. And of course, without them giving us the opportunity and trusting us to tell their story and do a campaign about their cancer journey, it's just an opportunity. It's a blessing for us to be part of their journey.
Yes, and we also invited an Elvis Presley impersonator. He's going to entertain everyone on June 19. And we also invited Miss World International Global 2019 and Mutya ng Pilipinas candidate in the Philippines, Mary Yasol, who is going to grace our show, and she's going to perform belly dancing and Zumba. Emerich.
Wow. Really exciting, really exciting. So
okay.
That's June 19.
Yes. Emerich, you have the floor now to introduce our special guest tonight.
Thank you. It's my honor to introduce our special guest tonight. He is our newly FACC Medical Advisor Board member, and he is also the director of the Breast and Pelvic Malignancies Program at Lifespan Cancer Institute. And he is also head of community outreach and engagement at the Cancer Center at Brown University and director of medical oncology at Rhode Island Hospital. Please welcome none other than Dr. Don Dizon. Welcome, Doc.
Thank you so much.
Doc, do you know how to say kamusta in Filipino?
Kumusta?
What other Filipino words you know how to
You're
say?
going to really embarrass me that way now.
Ay nako. Ay nako,
Nako.
Doc. Ay nako. Okay. I'm going to shoot the first question for Dr. Dizon. I understand that you are also a TikToker like me, okay? Now, what motivated you to become a TikToker, and what's the one video you made that changed everything?
So, well, I am a big believer in social media, especially for the communication of good information around cancer, but also to help humanize doctors, make it very clear that we are people first and that we feel things. And if our patients are doing well, we're happy to celebrate with them. But when they are not doing well and when they die, that it affects us too. So, what I liked about TikTok was the ability to create very small videos, which you can then use and put on Instagram, and you can put it on Twitter.
Mm-hmm.
And I think the ability to make video makes content more engaging.
So what
I
makes
actually use TikTok to generate content.
uh-huh. What makes TikTok different from other social media?
Well, I think it reflects more the attention span of the American public.
Remember,
it
TikTok is
grabs
from
them,
China.
but it grabs at 15 seconds. You can go
Mhm.
up to 60 seconds, and then it cuts you off.
Mhm.
Right.
But you know
So
what?
your
The
message has to be very
preparation,
clear.
it takes a lot of work also. Akala mo emerit siya, 15
yeah.
seconds lang yan, but you have to work so hard.
Of course.
I don't know.
Like an
I don't know
athlete,
if I work
they
that
would
hard.
so hard and then to get that.
But I use it. I actually use it to promote information and get people to understand
Uh-huh.
about some things said on social media are not true, and pointing them to sources, pointing them to good information is actually very good. I think that's part of, you asked what kind of information or what TikTok sort of made the difference. It really was speaking authentically, showing people who I was and what I'm interested in and things that I'm passionate about, but doing it in a very creative way. I think it was challenging, but I find it very interesting.
Well, can I follow up a question? Kind of piggyback with your Josie's question. So, Dr. Dizon, who inspires you to be a doctor, and especially specialize in cancer, right? Because there's other things that you could, select. with career. Yeah.
Specialize on. Yeah.
Who's that person?
Well, so it's an interesting question, but I will say my career, I'm a professor of medicine at Brown. Usually they get there, you specialize more. So you start doing general, and then you say you're going to do female cancers, then you're going to do ovary cancers, then you're going to see this one very specific kind of cancer of the ovary. That's not how I've done it. So I still see patients, I still do research, I do social media, I do TikToks. I have a sexual health clinic.
Oh my gosh, you are a very busy person.
Yeah, so I kind of did this rather than this,
Yeah.
But, the thing that motivates me is actually, I learn from every person that I treat,
Mm.
And so that's the motivation. Sort of every person teaches me something different about cancer.
Okay, Emmerich.
Yeah, I was gonna ask you. So you have a lot of accomplishments so far, and I was just reading some of your on your bio. Um, And how did you agree to be part of the FACC medical board advisor?
I think Ed asked. I don't know how Ed found me.
Really?
Ed is very good in researching and connecting with people.
Right. Well, the thing is, being on the East Coast, so far from home, I was born on Guam.
Mhm.
My parents are both from the Philippines.
Where
and they
in the
met on island.
Philippines?
So my mom was from, I think, Manila, and my
Okay.
dad was from Mexico, Sabanilla. So he's Kapampangan.
Mhm.
But they met on Guam, and they raised. We were born on Guam, and we were all of us. I have 4 sisters. We were raised on the island, but I've lived my entire adult life on the East Coast.
Mm.
So
Cool.
part of me has always wanted to do something to connect to the Pacific. So when Ed created the invitation to join this, it just seemed very natural, in terms of trying to give back.
And certainly we appreciate you saying yes. And now you're here with us and talking to us about what's happening in the cancer world. So we're
Have you always been active in the Filipino community?
Well, what's interesting, I just was asked to pen a piece on Stop Asian American Pacific Islander Hate. So I worked with a colleague from Yale, and our piece just got published for the Society of Gynecologic Oncology, all around the discrimination that our communities are facing. So to answer your question, though, Josie, I had not specifically had an opportunity to be involved, but I did do some work with the Guam Cancer Care Group, and before the pandemic, I was going back once, even twice a year, and giving lectures on the island. On one of my trips, I was literally traveled 24 hours, and I was there for 12 hours, and then I came back.
Mhm.
And it was just this opportunity. I promised myself if an opportunity arose, I would never say no.
Nice.
Appreciate that. Can I
Yes.
ask a question? I want to have a live because we always love food here. You, especially Josie, and Emrich. So,
Yes.
Dr. Dizon, what is the favorite Filipino dish you like to eat?
made or eat.
Or yeah,
Make
both.
is different than eats. So I
Exactly.
cannot make my mom's pancit, so I don't even try. But I love adobo, so I make that at least once a month. Fried rice, which we talked about, and then I make leche flan,
Ooh.
Oh wow, leche flan.
Mhm.
So
which I love that.
I hope they're watching right now. Your mom and your dad, because I'm gonna ask, and you gotta ask.
My dad is passed on, but my mom is still around.
Okay.
She
okay.
knows about this.
Oh,
So,
is she listening right now?
I don't know. She better be listening.
Oh,
You better be listening.
does she speak Filipino?
She does.
Absolutely.
Oh, magandang gabi, mommy.
So between your mom and your dad, because your dad is Kapampangan, who's the best cook?
My dad was.
Exactly.
My dad taught my mom to cook.
Exactly. Oh my goodness, Kapampangan food, man.
Oh no, he was. He could make a gourmet meal out of spam and eggs.
Right? Amazing.
Okay, Doc. You mentioned that you're into giving lectures about cancer. Have you been in the Philippines?
I have not been to the Philippines professionally, no. But so there's the organization that I'm most close with is the American Society
Mm-hmm.
for Clinical Oncology, or ASCO. They have a program called the IDEA program. It's the International Development and Education Award. And my mentee for the IDEA program is from the Philippines. It's
Mm-hmm.
Meredith Garcia Trinidad. So we've been meeting for the past year on Zoom, once a month.
Yeah,
So
because
that's been nice.
there are so many Filipinos right now, who's suffering from cancer, and it's
Yeah.
very expensive.
It is.
The
Yep.
cancer treatments in the Philippines.
Yep. Yep. Yeah. We talk about that. And we talk about, the ethics of delivering cancer care, especially, in situations where, the parents don't want the children to know, or the children don't want you to tell their mom that they have cancer,
Yeah.
So we talk about the ethics of cancer quite a bit when I meet with Meredith.
And plus, you guys can bring so much innovation. The treatments here is really advanced, and I'm not putting down the Philippines, right? But at the same time, learning from them, and it's like collaboration, as Dr. Dizon always love to emphasize. Really, that's how our mission.
Yep.
We collaborate, we advocate, and we do research, and of course, education is really a key component of our organization. So
Yeah, for sure.
And it's really an honor that we have Dr. Dizon for the Filipino American Cancer Care, and coming from Brown University. The name Brown University.
Yeah.
So we are so grateful and thankful for your volunteerism
Sure, absolutely. No
at the
problem.
FACC.
Yeah, I was happy to get involved.
Doc, so I had to ask, with all of what you've seen so far in your life and in your profession, have you written a book?
I have a blog series that I have, which I'd love to turn into a book. So if you know anybody, I am looking for a publisher.
Oh, I will refer you to my
There you go.
publisher.
Oh, you should do that. No, I have. I would. It's on my bucket list. I
But
would
then,
love to
if
write a book.
this is self-publishing, but
Yeah.
you don't have to pay him.
It's I'm on vacation next week. I'm supposed to be working on my book proposal.
Are you?
I think you should. It's a very good thing, and FACC will be supporting you. Now, my
thank you,
next
Josie.
question is, what do you like about what you do as an oncologist or as a doctor?
What's so interesting about that question, Josie, is the mindset that I take to oncology, which is a benefit from how I grew up. Death doesn't scare me because it didn't scare my family. We accept that people, it's part of life. And there's, I think I'm able to bring in that aspect into cancer care. So one of the things that motivated me to do this field was to be present for my patients from diagnosis to the end of life. And that I could look at someone in the eye and say, you do not have much time left. And that is a gift that I have because of my culture. And I think it's not something that a lot of people can do, but it's a true privilege to be able to walk somebody through a cancer journey and either see them cured or see them not do well and die from their disease. But in order, to bring comfort through the whole thing is a challenge, but it's also a privilege.
And that's very unique discriminator of our cultures, as you emphasized, Dr. Dizon. Another thing that I saw in terms of the our culture, and you and the medical advisory board, you guys becoming more visible, each time that we connect, and we want to raise the next generation of doctors. So what do you give them as an advice if they're planning to go to the medical field, especially specializing oncology?
Well, I think it's important that they be there. I think there's not a lot of diversity in oncology. And if there's anything, having taken care of an elderly Filipino patient, there's that connection just because cultural similarities are there, and there's that immediate trust. And I think that speaks to the importance that the clinical professions are as diverse as a population. So my advice is, if you want to do medicine, you're needed. And I think you should pursue it.
Doc, I'm sorry, Emerich. Are you the only medical doctor in your family?
I am.
Mm.
Yeah.
And who has had the biggest impact on your career choice?
I think my parents motivated me to succeed. My dad, with 5 kids, I was going to be the doctor. One was going to be a lawyer. One was going to be an accountant. He had it all planned out. It just happened that what he wanted for me is what I wanted for myself.
Oh, that's perfect.
So I think what it was, they gave me the skill sets to succeed, and then they gave me the freedom to do it. When I got into medical school, my mom was concerned that it would be too hard, and she didn't want me to suffer. So that was really nice, because she wasn't pushing me to do it so that she could brag to her friends that she had a son for a doctor. She was really concerned for my mental well-being. And that was, I think there was liberation in that. I think, I have a lot of friends who became doctors to please their parents, and they're not happy doing it. But in terms of the motivation today, like I said, it's sort of, the motivation of the people that I meet. This is a really incredible profession. You meet people you would never have met ever, and they're only there because they have a diagnosis, and you get to know them and you get to know their families. And it's such a wonderful gift. And I think that's what's the motivation. Even on my hardest day, when I'm seeing 20 patients in a clinic, every single person I remember and I get to know them.
And that really connection that you mentioned, Dr. Dizon, is really made a long-lasting impact to a patient. They will see that the doctor feel them. They connect, and then they see that, we're like, and you said a while ago too, doctor is also human. And that's how it should be.
Yeah.
It cannot be just say, hey, I'm a number to you, Dr. Dizon, or I'll see you just like pushing it just to get it done from a research or whatever, that kind of stuff, right?
Another statistics on your chart.
Correct.
But Doc, so with your dad and your parents inspiring you and giving you the skill sets, so the wishes, did it come true? What happened? How was your sisters? What are their professions? Is there a lawyer? Is there an accountant?
There's no lawyer. I have 2. One of my sisters is a VP of finance in Hawaii.
There you go.
One works for the banking system in Arizona. One is married to a military person and lives in Germany. And then my youngest sister is a graphic artist in Portland.
Oh wow! Wow.
Yeah. And everyone's very happy and content.
They are happy. That's the most important. I'm a banker as well. So
you are.
Your other sister in Arizona. Have you guys, with this in the middle of the pandemic, have you guys done any get together? No. So my sister and I are, I guess they call them Irish twins. So I was born in February and she was born in December of the same year. So we turned 50 last year. Wow. And we were supposed to get together and he'd do a huge Christmas, and we didn't do it because of the pandemic. So we're hoping for this Christmas, after everyone gets vaccinated, we'll be able to do it. But no, I haven't seen my family in 2.5 years. Wow. And we usually see each other every other year. Yeah, and it's different. Christmas. It's different when you do the screen. Yeah, it's very different. It's just different. I haven't been on a plane in, I think, since February of 2020. And how often does a doctor fly in a year? Well, I used to probably do 4 trips a month. Yeah. I used to travel quite a bit to do lectures. Yeah. Sure.
Okay. Now, from my end, as an oncologist, how do you approach discussing cancer diagnosis with patients and their families? What's your approach?
Right. So when they see me, it's oftentimes they already know they have cancer. because either their surgeon has sent them in or the diagnosis has been
Or second
made.
opinion.
So usually what I do is ask them what they know. So when I sit down, I don't tell them what I know. I ask, what do you know? What do you understand that's bringing you into my office? And then 60% of the time, they don't know. Yeah. And so I actually spend the time and introduce the concept of what cancer is and where they found their cancer and whether I think it's, local or if it's spread, that's an important thing. I think in the hospital, when I see people with a suspicion for cancer, that's a different story because it's always like there's something in your lung and it looks like cancer, but we need to do a biopsy and prove it is. So let's do the first step and then we'll go based on that information. But the one thing I tell Josie, everybody I see, if I don't think they're going to die, I tell them they're not going to die. And I tell them, if I think you're going to die, I will tell you. And I think that usually helps people relax a bit. Because every time you're seeing an oncologist and it's cancer, you start thinking about, am I dying? And it's the one question nobody ever asks.
Yeah. And that's always the question in people's mind every time. You're right. And I'm glad that you're talking to your patients around that. Now, we're talking about, I want to ask you regarding kind of like a diversity of patients that you see. Who do you, on the span or the period that you've been an oncologist, do you see a lot of men, women, white, black, Asian?
So my practice has been limited to breast and pelvic cancers for most of my career. So I would say 95% of my patients have been women. I see mostly a white population, which reflects the demographics of where I'm living.
Right.
But I see quite a few Latinx, and I still treat quite a few Asian American, and just Asian patients as well. Since I've come back to Brown in 2017, I've treat soft tissue sarcoma, and so I see much more men in my practice as well.
Wow!
But still, I would probably say it's 70% female, 30% male.
Okay.
Yeah.
And why did you specialize in pelvic and breast?
Well, when I was a medical student, I thought the most incredible surgery I saw was pelvic surgery in women. The anatomy of the female pelvis, and when cancer arises from it, it's an incredible process to remove that cancer. So I always wanted to do pelvic cancers, but in a lot of places, you would also do breast cancers as well as a specialty. So I trained in breast and pelvic malignancies. That's what I specialized in at Sloan Kettering, where I trained. And then I was doing that. When I came back to Brown, no one was doing soft tissue sarcoma. So I actually developed the program in soft tissue sarcoma with my colleague, Brad DiNardo, who does pediatric cancer. So at Brown, we have one of the country's only adolescent, young adult, and adult sarcoma programs.
Doc, can you enlighten us about this soft tissue sarcoma?
Sure. So really, if you think about cancers, right, there's three major types. There's one that begins in the glands or the skin. Those are called adenocarcinomas. Those are carcinomas. So, and then there's the blood cancers, which is the leukemia, lymphoma, myeloma family. And then there are these cancers that occur in the bone and the muscle. That's the soft tissues. Those are the sarcomas, and they all behave very differently.
Okay, Emerich.
No, I was gonna ask, during your lectures or places that you've been, or is there any study that shows in the United States, is there any parts of the country that has more of the pelvic cancer patients versus the other, east, west, south?
Not really, not really. You know what's so interesting is that in my neck of the woods, there just seems to be a lot of people that I see who are diagnosed with 2 cancers, sometimes even 3. So it's not uncommon for me to treat someone who has a uterus cancer and thyroid cancer, or breast cancer and colon cancer. I have more than a few of those patients that I'm treating now with sort of dual malignancies. You know, there are clusters where cancers are more apparent, and we always look at genetics when it comes to that, right? Because sometimes the genetics can explain familial cancers, but yeah, no, I've always studied and practiced in the Northeast. It's fairly consistent. So breast is the most common, you know, ovaries is the most fatal of the gynecologic
why breast?
cancers.
Why
Is breast so common?
Yes.
You know, that's an interesting question. I think part of it is because we can screen for it. So we find a lot of cancers at stage 0 in the breast and very small.
That's what I have.
So because we have an excellent screening modality, you're probably picking up cancers that probably would never have been detected at the time of death, this overdiagnosis issue. But it's also the most common cancer in women, and it happens in men. For the same reason prostate cancer is so common in men, you know. But it is the most common cancer. It certainly is not the most fatal cancer in women. That's lung cancer. You know?
Doc, how does cancer start?
Well, you know, that's a really complicated question. You know, on the cellular level, there's some people who are born with a mutation in their cells, right?
It's from the genes.
Yep. And then as they grow up, there's another mutation that develops as well. So once you knock out a normal gene, then you're more prone to get cancer. So there's genetics. There's also environmental issues. We know, you know, for folks who are from South America, there's a high incidence of cancers of the esophagus and the stomach, likely due to smoked foods ingestions. You know, if you look at the Hiroshima experience, right, with radiation, lymphoma is common, breast cancer is common after radiation exposure. So certainly environment has something to do with it, family history has something to do with it, you know, but at the end of the day, the majority of our cancers, we don't know why they happened.
In your family, is there a history of cancer?
There is breast cancer. Yep. Head and neck due to smoking as well. Prostate. Yeah,
we had some guests in the past that's second generations, and then now they have the kids, and then suddenly one of the kids have a cancer. And one of our beneficiary that we interviewed, none of the family members whatsoever. Now, they're from the Philippines, and they're from the province or the countryside.
Yeah.
So we don't even know if their history is really been diagnosed with cancer, or they're just finding
Data
it
to back it up. Yeah, so really important.
Yeah, I mean, it's very baffling to people when they get diagnosed with cancer and they don't have a family history. They work out all the time, they don't eat meats, and they don't drink alcohol, and they still got cancer. You know, I sometimes will tell people cancer happens to people who are healthy.
Yeah, you're right. Okay, we're going back with Dr. Dizon. We're going to continue our interview, but this time we are going to entertain Dr. Dizon. We have a special guest singing artist tonight, one of our young ambassadors at the Filipino American Cancer Care. She is a 19-year-old from Ellicott City, Maryland, and is currently a sophomore nursing major at Stevenson University in Owings Mills. She began singing at the age of 4 and taking piano lessons at the age of 7, and has loved performing ever since. Ladies and gentlemen, please welcome Katrina Manabat.
And I can't sweep you off of your feet. Will your mouth still remember the taste of my love? I still smile from your cheeks. Darling, I will be loving you till we're 70. And baby, my heart could still fall as hard at 23. I'm thinking about how people fall in love in mysterious ways. Maybe just a touch of a hand. Well, me, I fall in love with you every single day. And I just wanna tell you I am. So honey, now take me into your loving arms. Kiss me under the light of 1,000 stars. Place your hand on my beating heart. I'm thinking out loud that maybe we found love right where we are. When my hair's all but gone and my memory fades, and the crowds don't remember my name. When my hands don't play the strings the same way, ooh, I know you'll still love me the same. 'Cause honey, your soul can never grow old, it's evergreen. And baby, your smile's forever in my mind and memory. I'm thinking about how people fall in love in mysterious ways. Maybe it's all part of a plan. Well, I'll just keep on making the same mistakes, hoping that you'll understand. Baby, now take me into your loving arms. Kiss me under the light of 1,000 stars. Place your hand on my beating heart. Thinking out loud that maybe we found love right where we are. La, 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 So baby, now take me into your loving arms. Kiss me under the light of 1,000 stars. Place your head on my beating heart. I'm thinking out loud, maybe we found love right where we are. Oh baby, we found love right where we are. Baby, we found love right where we are.
Thank you so much, Katrina Manabat, one of our young ambassadors of the Filipino American Cancer Care. Doc Dizon, my next question. Do you like to sing?
I do, but I will not do it in public.
Yeah. Well, my question, I'm gonna, if you don't mind, Josie. So, you mentioned, Dr. Dizon, about the mental health, right? So what do you do to, get that mental state like out of work, just like have that kind of R&R relaxation? What do you do in order to balance and maintain, recoup your
What do you do when you're not working?
Well, I think part of it is that's where I like to write. It gives you that opportunity for self-reflection, and sort of what's been nice is that if I write about my experiences in the field, I oftentimes will tap into what other people are also feeling. So it's kind of nice to get that validation, but also to connect with people about how hard it is to be a doctor in oncology.
Mm-hmm.
I'm writing a blog for Medscape about how, with the pandemic, there's no line between work and home, because I do 3 days a week. I'm in meetings all day, like this, and I do it from home. So whereas before I would pack my bag and turn off my computer and get in my car and drive away from work, which was my break. Now I'm sitting at home, and I'm getting on my computer, but I can leave and prepare something, but then I can come back to my computer. So my meetings are running earlier and they're ending later in the day, and it's harder to maintain that balance. So I find it's very important to sort of have creative outlets. So that's where TikTok comes in, but that's also where my writing comes in. But I also like to cook, and that's where that's coming in.
Awesome.
I like how you said it, Medscape.
Yeah.
You do need to create a Medscape. And what sort of hobbies, what else besides the writing, do you do anything outdoor?
I I work out 3 times a week. I'm pretty religious about that. So I try to do it in the morning. That's when I have most of my time. As the weather gets easier, I like to either bike or rollerblade outside.
Yeah.
Cool.
Now, just a quick change of subject here, since we're in the middle of the pandemic. And what do you say to your patients that are, diagnosed with cancer or taking this journey, and then plus the pandemic? What kind of advice on safety would you tell them? And to our listeners as well, of course.
Well, I think, all we can do is take care of each other. And, my patients feel the weight of the risk. So most of them are, they're sheltering at home, but, pushing masks and physical distancing rather than social distancing. The difference being you can be physically separated, but you can still connect, right? And then, frequent hand washing, and that's what we can do. And then I am encouraging all of my patients to get vaccinated. Yeah,
CBS released some information. I think it was a couple of weeks ago that their number of flu medications that they have still on the shelf, because people started washing their hands.
Yeah.
So there's not a lot of cold or flu.
Yeah, the flu. Yeah, the flu numbers were much less because of these precautions we were taking around COVID. Yeah.
Can you believe it?
Yeah.
Do you encourage your patients to get to be vaccinated?
I do. And I think the reason is we know if you have cancer and you're on treatment and you get COVID, it is more likely you're going to be hospitalized, and you're at more of a risk you're going to die. So at the end of the day, the vaccination prevents hospitalization and death. And I think that's the most important outcomes that I want for my people who are getting treated or have been diagnosed with cancer. So yeah, I think the risk and benefits really do favor vaccination. So, and if you're on chemotherapy, this is an important point as well. Chemotherapy affects a very specific blood cells, right? It affects the neutrophils. And the neutrophils are what put you at risk for bacterial infections.
Immune systems.
But your lymphocytes are not usually impacted by chemotherapy, and it's your lymphocytes you need to mount a response to the vaccine. So the vaccines should still be effective, even if you're on chemotherapy.
That is a very good point.
Wow, I'm learning a lot of things from Dr. Dizon.
We got a doctor,
Wealth of
a professor,
information.
a doctor, a professor. and
Yes.
everything else, you know. So he's doing these lectures, and a lot of hundreds and thousands of people are listening.
Yeah, and I think it's a really important point. But at our center, especially when you couldn't easily get the vaccine, people are getting their chemo and then getting vaccinated the same day.
Okay.
And then that's the reason why.
So, how do you feel about the future of cancer treatment and cure in the United States?
Well, I think we're going to be each year. I think we're closer to turning cancer into a more chronic condition. Certainly, I've seen people with metastatic cancer whose disease melted away on these novel therapies, and it's been miraculous. So I think, we are moving to a point where we want that to happen more commonly. But the thing that scares me the most is the costs of care.
And I want to piggyback Dr. Dizon about that, because April, we kind of allocated it as a cancer and finance. And last week, we talked about the financial toxicity. Imagine, community of scholars really hit hard. And, they have no choice. Cancer did not but again, expand how the financial toxicity really adds up into the mixture of stress.
Well, let me put it this way. So there was a really interesting study that was presented where, if people didn't have financial means before they got diagnosed with cancer, that didn't really impact how they did. So they survived cancer all the same. But if because of cancer, you became poor or you were financially stressed, you were at more risk of dying. Okay. So the financial toxicity after a cancer diagnosis had really grave implications for people. But you're talking about, even if with good health insurance, some of these oral therapies, the out-of-pocket costs range anywhere from $65 a month all the way up to $1,500 a month. That's not sustainable.
Mm-hmm. How much more in the Philippines? That's why some of our beneficiaries last Christmas and previous months, when we did all of this fundraising, some of them, they just died because in the Philippines, you have the best doctor, but then you don't have that advanced technology in terms of treating cancer.
Right. There was my mentee, Meredith, was telling me about a case. Dr. Trinidad was explaining a case of a young woman who was diagnosed in Dubai with breast cancer, but she couldn't get treated in Dubai. So she came back to the Philippines for treatment, but she didn't have the insurance. And by the time she was able to get treatment, she had metastatic disease. These are real issues, especially in the United States, where, despite the risk of financial toxicity, these things are still available. But in other parts of the country, it's all out of pocket, and it's not available to many people. And so there's still this huge disparity, worldwide disparity, that needs to be addressed. So the WHO is trying to come up with the essential oncology medication list. And there are certain drugs that everybody, no matter where they are, needs access to, like Herceptin or trastuzumab, which is for HER2-positive disease. That drug can turn a nearly fatal cancer into a cure. And everyone should have access to it.
At this point in time, Doc, what is the focus of your research?
So my research is focusing on caregiving. So I do some work on caregiving. I am coordinating with a study with Harvard on the use of patient-reported outcomes, which is reporting how you're doing while you're at home, rather than waiting for you to come into the hospital to tell me how you're doing, right? So patient-reported outcomes. I'm running clinical trials still in ovarian cancer and in uterine cancer, as well as in breast cancer. And then I started this group, and we had our first meeting last week, called the Collaboration for Outcomes Using Social Media in Oncology. So I'm pretty diffuse.
Mm-hmm. Your parents must be very, very proud of you. Can you imagine this, Ed? No? We have someone, a Filipino American, who's doing great in the advancement of cancer cure and research.
And it doesn't matter wherever you are, he'll give you the information that you needed. Listen, give you resources, where to find the answer for you. I mean, it's just amazing what you're doing now.
Thank you.
And it's very important, and I'm glad that you're doing it. And you're actually using the platform where a lot of young adults and actually Gen X, Gen Y, even the boomers are all in TikTok or Facebook or Instagram. So I'm glad that you're utilizing that.
And speaking about young generations, Emerich and Doc Dizon, I noticed also that there are a lot of, adolescents like millennials that are suffering from cancer.
Mm-hmm. Yeah, I mean, I don't know. Well, there are quite a few young people who do get diagnosed each year, and it's hard to say it's rare in this group to get cancer when you're the person that's been diagnosed. What I think it is, cancer is almost like joining a country club, but you never submitted an application, right? So once you get diagnosed, you find you're a member of a community and that you're not alone. And I think that's a good thing, because it's such an isolating experience, especially if you're young, to be told you have cancer. Because most of the waiting rooms, even here in Rhode Island, the average age is in the 60s, and to be 25 with breast cancer, it's very shocking. But it's also important to know that you are not alone.
Dr. Dizon, I can totally relate to that particular point, because 5 years ago, when I was diagnosed with cancer, either the kids in Hopkins, that breaks my heart, or the older stuff. So trying to find, that's why I think when Josie and I also connect, we said, we have to do something about this gap to really, be visible. And, I've been upfront telling my story as well. Hopefully other people will be able to have that kind of survival guide, right? You're not alone. Somebody went through there. We're here to support us. And I'm now starting to really fully embrace the newfound cancer community as you.
Yeah. And because, like it or not, you're sort of a steward in the community because you survived it.
Yes.
Yeah.
Absolutely.
All right. So do you have other question, Emerich, that you want to?
Nope, I don't.
Okay. So lastly, we're going to ask Dr. Dizon to give some advices to our followers and viewers, to everyone who's watching us right now. And your message, Doc.
I think the message is that we are actually, no matter where you live, we're one people in one society. And honestly, if the pandemic has taught us anything, is that the fate of each of us is really dependent on the other person. So we need to take care of ourselves, and we need to take care of each other. And if you see hate, you just cannot afford to sit idly by and watch it happen.
Mm-hmm. Have you experienced hate in your career?
I haven't, fortunately. Well, no, that's not true. When I was in medical school, there was a student who was very anti-Japanese and was very, very open about it. And I did confront him, because it was an affront to me as a Pacific Islander, as an Asian, to hear that. It was just wrong. And I think, there's two concepts that I just learned about. One is the model minority, right? That, the model minority is that person who goes to college and lives in a house with a white picket fence and the kids go to private school. And this is what America wants for their minorities. This is the picture they want for us. And it excludes anyone who's fresh off a boat, And it excludes the fact that not all of us are upwardly mobile, So there's sort of this pigeonholing effect, but there's also, the more important thing is, there's a bystander effect, right? Where you see someone getting harassed or harmed because they're Asian or Black, and you do nothing about it. And there are ways that you can intervene without putting yourself in harm's way. And it can be as obvious as physical violence, but it can also be not obvious, like when someone says, "Oh my gosh, your English is perfect."
My English is not perfect.
Well, yeah, it's just like, it's like
the unconscious bias.
Unconscious bias.
That's right.
You need to call people out.
So, Doc, one last question. Pahabol lang ha. What is the greatest lesson you learned from your Filipino parents?
Humility. That I am not better than the next person. Yeah, my parents are very humble. Yeah.
How I wish I would be able to interview your mom. Tatawagan ko na si nanay o si mami?
Oh, I can introduce you to her if you want.
Oh, yeah.
I credit her for everything. Every book. So I have written a book, by the way.
I think I'm going to interview your mom for Mother's Day.
You want to? I'll introduce you to her.
Is that okay? I would like to feature her on my radio show.
No, but I have written, I'm a major editor on the gynec textbook that they use in the United States. And so I publish books, but I want to publish a book that's not medicine. So
Yeah.
Something like a memoir.
Not a memoir.
Something about mommy.
Not a memoir.
Story.
So, Doc, please introduce me to your mom if if she will allow me to interview her.
I will see if she was listening.
What's her name?
Millionita.
Millionita.
Oh, I love that name.
That's very unique.
Yeah, my name and her name. Look at that.
Emma Rich and Millionita.
Am I rich?
I love it.
Yes.
So is she still in Guam?
She's in Hawaii.
Oh, nice. She's having a great time.
My dad is buried on Guam, so she goes back and forth.
Okay. Thank you so much, Doc, again. Emma Rich, pwede pa ba? We have 2 minutes.
You get 1 minute.
1 minute. 1 minute ka na lang.
Okay, 1 minute. All right, this is for you, Doc.
Anong kakantahin mo, Mr. Doc?
It's just once. Here it goes. I did my best, but I guess wasn't good enough. It's here like we were before. Seems nothing ever changes. We're back to being strangers, wondering if we ought to stay or head on out the door. Just once, can we figure out what we keep doing wrong? Why we never last for very long? What we're doing wrong? Just once, can we find a way to finally make it right? To make the magic last for more than just one night. If we could just get to it, I know we could just do it. That's it.
All right.
Everyone.
Thank you.
Thank you so much, everyone. We will see you again next Friday. Dito pa rin sa PHLV Radio, on the air with FACC. Bye, everyone. Happy weekend.
Happy weekend.
The Filipino American Cancer Care has just brought you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.
is your Filipino radio experience in Las Vegas. PHLV Radio.